When we look at the notes here, grief counseling, helping people to facilitate uncomplicated grief or normal grief to a healthy completion of the tasks of mourning within a reasonable time frame. That would be basically anything after that year of firsts. And remember, we talked about the year of firsts, going through that first year, holidays, special dates, normal daily activities, without the loved one being physically present. But one of the tasks is to reassess, change that relationship, but you're not actually ending the relationship completely. Grief therapy, specialized techniques described later in Chapter 5, which are used to help with abnormal or complicated grief reactions. Support networks, family, any type of religious or spiritual organization, funeral rituals, which serve to facilitate the process. So any type of ritualization within one's culture or society, and basically any other type of support network. So in Pittsburgh, we have 2 support counseling networks focused primarily on grief and loss. One is the Good Grief Center that's located in Squirrel Hill. Diana Hardy, one of my previous students, is now the director of that. And the Caring Place, which focuses on children, grief, and loss. And that's through Highmark and Blue Cross Blue Shield, and it's called the Caring Place. One of our previous students, who now has his doctorate, Demond Bledsoe, just began a position as their community educator, and I think he'll do a great job with that. So if you need to make a referral, those would be my first 2 choices, and the Caring Place is located downtown Pittsburgh. Goals include completing unfinished business, gaining a sense of closure, correspond with 4 tasks of mourning to increase the reality of the loss, to help the counselor deal with both expressed and latent affect. Affect is expressed emotions, and to help the counselee overcome various impediments to readjustment after the loss, and to help the counselor find a way to remember the deceased while counselee find a way to remember the deceased while feeling comfortable reinvesting in life. Receiving grief counseling, identifying at-risk bereaved. Beverly Raphael, 1977, lists following variables as possible predicators. There's a high level of perceived non-support in the social network during this crisis. If there's a moderate level of perceived non-support in the social network, together with particular traumatic circumstance of the death. A previously highly ambivalent marital relationship, or any type of significant relationship, whether it's marital or not, with the deceased, maybe traumatic circumstances of the death or any unmet needs may result in complicated grieving. The presence of a concurrent life crisis, more than one life crisis. Sheldon and colleagues looked at 4 predictors. The socio-demographic variables, personalities of the individuals, social support variables, the meaning of the death event. What type of meaning? And we just began talking about meaning in our previous lectures this evening. Parks, Bereavement Risk Index. There's young children at home, socioeconomic class or status, because that adds additional stressors. Employment, anger, secondary emotion, pining, yearning, self-reproach, lacking of other relationships, coping assessments by raters requiring help, counseling principles and procedures. Principle 1, help the survivor to actualize the loss. And this follows task models in general. So these are basic procedures and steps in normal grief counseling. So, encouraging discussion about the loss. And I'd like to talk just a little bit. We talked about the taboo of discussing death in American culture, and it's often referred to as the elephant in the room. And I personally believe that it's taken on this aspect of taboo in America, or something that Americans don't talk about, because people are uncomfortable with it as a result of fear. Maybe they don't want to cause any more harm, they don't know what to say, or fear of mortality or loss themselves, fear of the unknown. But a general discomfort in our culture, also due to lack of ritualization and the expectation that grief and mourning doesn't take a long time in American culture, when in reality, we've discussed, it could take a year or more. Principle 2, help the survivor to identify and experience feelings. So many times we want to repress or suppress feelings because these feelings are painful. They create anxiety and discomfort and sadness and minor depression. And yet these emotions need to be explored. Americans want to be happy. Something's wrong with us if we're not experiencing happiness. And yet it's so important to experience that full range of emotion and to move through these emotions, not to avoid them. Where are these feelings directed? Look at both negative and positive feelings. Number 3, assist the living without the deceased. What roles were played by both individuals in the relationship? What role did finances, sexuality, dependency, and other roles play in the relationship? And how will those roles play out now with this change? Discourage the bereaved from making any major life changes, because they're a result of fear and anxiety, grief and mourning. So don't make any major life decisions until some of these emotions are processed. Help find meaning in the loss, and I would add, in the present life. What roles does spirituality play, if any, or belief systems? That includes atheism, agnosticism. What other ways can meaning be found? We talked a little bit about that in our other readings today. Principle 5, facilitate emotional relocation of the deceased. The act of reminiscing or telling stories is very beneficial. Provide time to grieve. We've talked about this. Interpret normal behavior. Many people have never experienced such powerful emotions. They think they're going crazy, but they're not. But we do have to consider, is there a previous history of psychiatric diagnosis or issues? Allow for individuals' differences. Everybody grieves in a different way. Examine defenses and coping styles. Are they medicated? Are they using drugs or alcohol and self-medicating? Are they employing any other coping mechanisms that are healthy or unhealthy? And identify any pathology, and if there is pathology, refer to a competent individual, or if you are that individual, don't ignore it. Process that. Useful techniques. Evocative language. Use language that can evoke feelings or responses, but be prepared to process that. The use of symbols, photos, letters, meaningful objects to facilitate dialogue. Writing letters, keeping journals. Drawing, especially with children. Role-playing, and we'll discuss this with complicated grieving. Cognitive restructuring. Our thoughts influence our feelings. Hence, we can help the client to identify some irrational thoughts. We'll talk about magical thinking as well. Creating a memory book. Directed imagery or visualization for the survivor. Using metaphors. Sharing narratives and stories. Medication can be useful, but only if it's used sparingly for an appropriate length of time for the appropriate reasons. In counseling groups, groups should have a purpose, a structure, logistics, pre-screen, define the expectations. Groups are very helpful, as we discussed previously. Should they be ongoing or have a timetable? We're going to talk a little bit more about group therapy as well as rituals. That is a basic overview of your readings for normal grieving. We're also going to talk a little more about techniques, therapeutic techniques with this next week. Next week's going to be a pretty big week. We're going to begin talking about complicated grieving in more detail. All right, have a nice break this week, and I can't wait to see your posts.